At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Horde.
Greetings, and welcome to Prevent Blindness Focus on Eye Health podcast. I'm your host, Christopher Horde. This month, we'll be talking to Evelyn Jordan about her vision and healthcare journey. Evelyn has dealt with vision loss due to Stargardt disease, as well as being diagnosed with multiple sclerosis. We also talk about her involvement in a telephone-based spiritual and social ministry called Phone Faith. Additionally, we'll be discussing several initiatives that Prevent Blindness will be involved in this month. This is our penultimate episode. We'll be ending our season in November and using December to plan ahead for our second season, which will launch in January 2026. We thank you for being part of our journey. Don't miss out on the season finale in November. But keep listening because we start right now.
News.
Prevent Blindness goes to Congress to host World Sight Day events. October 9th marks the 2025 World Sight Day, and Prevent Blindness will observe it by hosting events at the U.S. House of Representatives. We joined the International Agency of Blindness Prevention and its member organizations in focusing on making eye care accessible, available, and affordable for everyone. On that day, Prevent Blindness will have two events at the House of Representatives. We will be taking part in a briefing to Congress members. In the meeting, we will advise representatives about the vital role that eye health plays in children's learning ability, social development, and lifelong well-being. In addition, we will act on this important need by conducting free vision screenings in the lobby of the Rayburn Building from 9 a.m. until 3 p.m. If you're in the area, we invite you to come in and join us. See our website at preventblindness.org for more information, or click the link in our show notes. Prevent Blindness affiliates will also be hosting events on and around October 9th to commemorate World Sight Day. Check out a new podcast from our Texas affiliate. Not everybody might know that Prevent Blindness is not just a national organization. Prevent Blindness also has several affiliate organizations representing various geographical regions of the United States. We'd like to take a minute to acknowledge the members of Prevent Blindness Texas, who have also recently launched a podcast. In a play on the word inspiring, the podcast is called Eye-Spiring. Hosted by Prevent Blindness Texas CEO and President Heather Patrick, the podcast discusses issues of eye health, vision loss, and availability of vision care. The podcast will be of special interest to residents of Texas, where the affiliate is an active and vital contributor to various healthcare initiatives. Last year, Prevent Blindness Texas served over 60,000 people, and the podcast increases their outreach ability. In the most recent episode, Heather interviews Prevent Blindness CEO and President Jeff Todd. You can subscribe to the Eye-Spiring podcast at all major podcast distributors, including Amazon and Apple. You can also find episodes on their YouTube channel, or click on the show notes below for more information.
Feature presentation.
Thank you for being on our podcast. I'd like you to introduce yourself. Please tell us your name and what you do.
Okay, thank you, Chris. My name is Evelyn Jordan, and currently I am working as a volunteer for an organization called Phone Faith, and it is an outreach ministry for adults with who are visually impaired or who are blind. It is sponsored by the Christian Records service for the blind and low vision, and that falls under the Seventh-day Adventist Church. But anyone is welcome to participate in Phone Faith. And Phone Faith basically is a ministry that people can call in 7 days a week, and it offers, we have different types of programming. It involves Bible study and games. We talk about, we have speakers who come on and talk about health issues, diabetes awareness. Sometimes we have people who talk about, there's a day during the week where we talk about making a difference. And people are able to come in and tell their stories about how they're making a difference in their community. Sometimes I presented on different topics, and some of the topics were loving yourself, how we should help cater our needs to the things that are going on in our lives. So sometimes we're very nervous and we're upset, and a lot of things that we go through in life that can impact our health. So one day I made a presentation about bioequilibrium, why it's important, because it was so hot, and the importance of staying hydrated, and just a lot of different things. Other professionals who are coming in, and they talk about things that they're involved with in technology when it comes to accessibility. But we need to have more input from individuals who are dealing with blindness and low vision. And so we have speakers who are coming on to talk about what they're doing in the blind and low vision community. And sometimes I think on a quarterly basis, they have a minister who comes in, and there's maybe a 3-day revival, and they talk about things that we need to know in order to cope with our everyday lives. Those are some of the things we deal with in Phone Faith.
All right. Well, that's a very unique project. Can you tell us a little about yourself, how you arrived at a point where you felt like getting involved in something like this?
Yes, I was, after I retired early in 2013, and I was dealing with, I had been diagnosed with multiple sclerosis, and then I wanted to give back to the community, and I was on a medication therapy to help address the multiple sclerosis. So I wanted to be involved in advocacy. And so the pharmaceutical company had an outreach program for patients who were on the best therapy. And so I would reach out to people in my cohort group to tell them my story about how I was dealing with the MS and some of the things that I did to keep my body strong and healthy. Because one thing my doctor told me, he said, keep your body strong. And so I tried to advocate and encourage people who were on treatment to do the same thing, to be compliant with their treatment and to adhere to what their doctors were advising them. And then I became involved with the Center for the Visually Impaired because I was diagnosed with Stargardt's in 2007. So I went through mobility training, and I had someone to come to my home to show me the accessibility features on my computer. And then I was invited to, because I had experience in human resources when I was working. I worked for AT&T, that's where I retired from. And I worked in the human resources department my last 10 years. And I was a staffing manager. I was a coach. I was a trainer. And then I was associate director. And then I also was a lead recruiting manager for disability and diversity recruitment strategies. And so when I spoke with the Center for the Visually Impaired, I was invited to join their HR advisory committee. And so what we did, we actually looked at external hires and making sure that everything was in compliance with labor laws, and making sure that the salaries were competitive with the other industries, and because this was a nonprofit. And so we wanted to make sure that their salaries were also competitive with industry standards for the private sector. And so that's how I got involved with the Center for the Visually Impaired. And then I met one of the directors who was over Phone Faith, because she was also involved on the subcommittee for the Center for the Visually Impaired. And so she invited me to join the advisory board for Phone Faith. And that's how I got involved with Phone Faith.
All right. Very good. Now, please, can you tell us a little bit in your involvement through Phone Faith, a little something about maybe something that you've learned about what benefits this provides to the blind and low vision community, and why folks might be interested in it?
Yes, it was a very interesting time for me, because I was going through a lot of transitioning in my life, and so when I got involved with Phone Faith, I was able to. Phone Faith is really, it builds community, because it's an organization, it's an outreach program, a ministry that you can call in someone who is visually impaired or who has low vision, because most of the time I've learned, even dealing with my situation with Stargardt's, it can be very isolating. And this provides a level of support, knowledge and information, community, and people who come on, they're always, they're excited about learning different things. They, even on Friday nights, you can showcase your talent. We have people who can sing, they play instruments, they are poets, they're writers, and just from all different walks of life. And so they don't allow their situation to prevent them from being engaged. And that's one of the things that Phone Faith offers, is an opportunity for people to engage on different levels. And I've enjoyed being a part of it. And I invite anyone to join. And if they want to learn more about it, it's christianrecords.org. And Phone Faith is listed there, and they can click on the link. There's a calendar of daily events that's available. And also Christian Records provides certain services. They are an organization that provides services to people who are blind and have low vision throughout the world. They provide books in Braille, regular books. They have downloadable books people can download, and everything is free of charge. They also have camps for children, blind children, throughout the U.S. And so it's a really strong organization that helps people and dedicated to people who are blind or who have low vision.
Okay. That's very good information on why people might want to get involved and how. I think we'll kind of sum up. I'll just simply ask you, from your experiences, can you tell us something that either you maybe learned that was new, that surprised you about your own condition or the community, or something that was just very strongly emphasized by your experiences?
Yes, I was diagnosed with Stargardt's disease in 2007. I was still working and I was still driving, and then I started noticing that when I would drive, cars would disappear and then they would reappear. So I went to a doctor, because my sister had been diagnosed with Stargardt's and her son was diagnosed with Stargardt's. And so I thought maybe that may have been what I was experiencing at the time. So when I went to the retina specialist, she confirmed that that's what it was. And in 2014, she recommended that I go through genetic testing through the eye center, the hospital that she was affiliated with, and I did. And when the results came back, it showed that I had a dominant gene they didn't know what it was at the time. And also it showed that there was a variant gene, the ABCA gene, that's associated with classic Stargardts. But she wasn't sure about the dominant gene. And so fast forward, I participated in, my doctor recommended that I participate in a genetic study that was being conducted, sponsored by the Foundation for Fighting Blindness. And it was performed by Inform DNA. And the results were very interesting because when they did my genetic testing, they tested my condition. They took the DNA sample and they looked at 322 genes. Overall, the diagnosis was sort of inconclusive because of the technology, and that dominant gene was identified, and it was a ELOVL4. It's a dominant gene, and it's associated with Stargardt-like conditions. But the overall clinical diagnosis remained the same as Stargardt's. But this gene, this dominant gene, you only have to have one to pass it on to your children. And it's actually found in bullseye macular, I think it's a bullseye macular dystrophy or something like that. And then this is something that it's just like Stargardt's. It builds up the waste products on the macular, and it causes you to start losing vision in your central vision. The photoreceptors are not able to receive light. And there was also another finding. They did find the ABCA4 gene, a recessive gene that's associated with classic Stargardt's, but they couldn't find another mutation because you have to have two recessive genes that's associated with Stargardt's in order to possibly have the manifestations of the Stargardt's disease, but they could not find that. There was also a third gene that was found, and also the lady was telling me who was giving me the feedback. She said 1 out of 30 people worldwide carry one mutation of the ABCA4 gene. And I only had one. So that means I'm a carrier of Stargardt's. And there was a third mutation. It's a recessive gene. It's NMNAT1. It's a recessive gene. And that gene is it's a mutation. I'm just a carrier. And it can cause, if I had two, as a child, it can cause severe vision loss. And then the last one was a gene. It's called TTC8. That's a recessive gene, so I'm a carrier for that. These two. So a lot of different things were happening with my vision, and so I learned a lot. And I learned that I'm not alone because I've always been afraid to face my vision loss. When I was diagnosed with multiple sclerosis, it was a mild case. On a scale of 1 to 10, I was at a 2, and the doctor said if I took care of myself, I'll be fine. I'm fine right now, and thank God. And so the multiple sclerosis was sort of in the background. It's not something that I deal with daily, but having to deal with the vision loss was something I dealt with daily. Mm-hmm. And so I felt alone. I felt isolated. I went through a lot of transitions of the last 2 years. And so I found that I needed to have some support. And I was involved in another organization because I went through a divorce. And so I was in a support group. I went through counseling, and I was a support group for women who were going through a divorce. And I found so much help and information and people who were going through similar things, and I felt empowered. And so when I went and I said, I need to get involved some way in some type of advocacy. And so when I visited my doctor earlier this year, and I asked her if, because I go to Emory Eye Center, and I asked my doctor, my ophthalmologist in the low vision clinic, I said, do y'all have a speakers bureau? And she said, no, but I know of a program that you would enjoy, you would be well suited for. And that's when she introduced me to Julie. And when I met with Julie, she invited me to join Aspect. And so I'm a new member of Aspect. But when I just started the training in August, and so I felt at home.
Okay. Well, thank you for sharing your experiences with us. And I'm
Welcome.
sure some of our listeners will be interested in checking out that information.
You're welcome.
All right. Is there anything else you wanted to add?
No, what I wanted to say also is that I found that storytelling is powerful. And when, because that's how movements start. And through someone telling their story, and we all have a story. And that's what I like about Aspect. It empowers us and gives us the information, the tools, the resources to tell our story, and then we can advocate for the things that we need, for what the community needs, the blind and low vision community needs. We can and other people who are even working in the field. That's what I like about it, because it's holistic and it has people from all walks of life, from the professions, people who are working in who are doctors, who are doing vocational rehab, just all types of individuals who are passionate about serving the blind and low vision community. And that's why I really enjoy Aspect, because it gives us the power to tell our stories.
All right, Evelyn. Thank you very much for being a guest on our program.
You're welcome. Thank you.
Announcements.
Prevent Blindness declares October Contact Lens Safety Month. The U.S. Food and Drug Administration estimates that about 45 million Americans wear contact lenses. Used properly, contact lenses can significantly improve a user's vision. But improper use of contact lenses can lead to eye irritation, infection, or even blindness. Prevent Blindness urges you to speak to your eye doctor before using contact lenses. Additionally, it is important to remember that even cosmetic contact lenses require a prescription. Even though they do not correct your vision, it is important that they are properly fitted and that you are properly instructed in their use. Anyone who attempts to sell you contact lenses without a prescription is violating federal regulations. If you wear contact lenses or are thinking of becoming a contact lens wearer, it pays to be well informed. Prevent Blindness offers many resources to help you learn how to protect your sight. We offer fact sheets, shareable graphics for social media, dedicated web pages, and videos in our Focus on Eye Health Expert series. Please visit our website for more information. And please, if you are experiencing trouble with your contact lenses, contact your eye doctor right away. Prevent Blindness offers free resources to fight inflammatory eye disease. October 20th through October 26th is Inflammatory Eye Disease Awareness Week. Every year, millions of people will suffer from inflammatory eye diseases, leading to tens of thousands of cases of blindness worldwide. The most common of these is uveitis. These diseases can be caused by a variety of circumstances, including infection, irritation, injury to the eye or the surrounding area, and many others. Early detection and treatment is key to protecting and preserving your sight. This is why Prevent Blindness makes a variety of resources available at our website to educate and inform you about inflammatory eye diseases and their treatment. We invite you to visit our website to learn more information or click the links in the show notes below.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
Thanks for listening to the Focus on Eye Health podcast, and thank you for being part of our journey during the first season. Please join us for our November episode when we'll discuss diabetes and the relationship to eye health. Diabetes-related eye conditions are the leading cause of preventable blindness. The number of diabetics in the world grows every year, so this issue will touch many of our lives. Join us for our season finale to learn more about these diseases and what can be done to preserve your sight. Please join us for our season finale in November. I'm your host, Christopher Horde. Thank you for listening. Enjoy and share.